I'm going to ask Dr. Greg Kuchar, the President and CEO of Mayo Clinic Health System in the region, to join me up here with Mark Cook, who's the Chief Administrative Officer for Mayo Clinic Health System. He's based in Rochester. Dr. Tim Deaconson, who is the Chief Operations Medical Officer for Mayo Clinic Health System in our region. And these gentlemen get the high honor of doing something that really symbolizes what we're here for. And so all you folks with cameras, we're going to unveil the sign first. Get the precious B-roll out of the way, and then we'll go on with remarks. All right?
So just going on.
Go ahead and tear her down.
All right, let's go do it. This takes a lot of training.
One, I feel like Mankato. 3, 4. All right. There we go.
Thanks so much, everybody, for being here, and good morning. Kevin already introduced us, but I'll just do a go at it again. I'm Greg Kuchar, Dr. Greg Kuchar. I'm the President and CEO, with papers on the floor, of the Mayo Clinic Health System in our region. And with me is Dr. Tim Deaconson, who is Chief Operations Medical Officer for our region, and Mark Cook, who is Chief Administrative Officer for Mayo Clinic Health System, and we're grateful to have him here. So today we're launching this new brand for all of our Mayo Health System locations, both here in South Central Minnesota, Northern Iowa, and in 70 communities in Minnesota, Iowa, and Wisconsin. Our brand expresses our desire to build upon our heritage of putting the patient first. We want our patients to understand that Mayo Clinic Health System brings them the power of Mayo's collective knowledge right to them in their own communities, and we do it by working together. Mayo Clinic Health System is the expression of the Mayo Clinic in our community-based practices. At this time, I'd like to introduce Mark Cook, the Chair of Mayo Clinic Health System Administration. Mark?
Thanks, Greg. Boy, what a great day. An exciting day. With any luck, maybe a little sunshine will peek through here. Mayo Clinic Health System has evolved over time, and today our sites work together more closely with each other and Mayo Clinic than ever before. We do operate as one system and work together to provide our patients with the care that they need, where they need it, whether that's in their hometown, like Mankato, a neighboring community, or in Rochester. And our new name reflects that. Since joining Mayo Clinic in 1995, the providers and staff here in Mankato have worked with their Rochester colleagues to improve health care by sharing resources and expertise, developing common patient care and safety practices, and collaborating with other locations to improve care regionally. For our patients, this is the best of both worlds. Patients will continue their long-term relationship with trusted providers, with the knowledge and expertise of Mayo Clinic supporting them. At the same time, they'll have the ability to tap into Mayo Clinic during times of their greatest medical need. The brand change recognizes the great work we've been doing in the health system for the past 19 years, but it's also aspirational, looking forward to the things we will accomplish in the future as a more integrated organization with one focus: our patients. As we continue working more closely together, our new brand will reflect our common approach to patient care. In a sense, this brand change also reflects a change in who we consider our team. Our team includes 56,000 people across our enterprise. We are a part of Mayo Clinic. In some cases, we use the knowledge generated in other parts of Mayo to help improve care. In other instances, we're creating knowledge right here to share throughout Mayo to improve patient care. In particular, Mayo Clinic Health System skills and community-based care are essential to Mayo Clinic's future success, and we're being asked to lead the way. Thank you, Dr.
Thank you, Mark. We are really excited about this. We're proud of what we're doing. The staff here is very proud of what we're doing. And to talk about that a little bit and where we're going is Dr. Tim Deacons. Tim?
Thank you, Greg. You know, this is an exciting time for our organization. The patients, the communities of all the hospitals we serve in the Mayo Clinic Health System. And what this means is that specialty by specialty, department by department, we are bringing to the local communities more of the knowledge and power and resources of the Mayo Clinic Health System, so that, as Mr. Cook said, patients can stay with their long-term trusted providers and get more of this care closer to home. Medical knowledge doubles about every 4 to 8 years, and being part of Mayo Clinic means that we'll be able to bring more of that knowledge, more of the research as we diffuse that into treatment and make it real in the trenches of patient care, closer to home, to satisfy our patients' desire to have the highest level of care as close to home as possible, and at the same time, during times of urgent need, be able to quickly tap into the resources of Mayo Clinic Rochester. Greg?
Thank you. This is not really like turning on a light switch. This has been a process we've been undertaking for many years to get to this point. Some things will change right away. The brand name that you see, the signs, the name badges, the way we answer the telephones, those are important and they're symbolic, and they tell a lot about who we are and what we're becoming. At the same time, this is a point in time where to announce that we're embarking on the next step of our journey as we bring practice together, as Dr. Dickinson was talking about, for our patients. And there are things in place already that make that happen. For example, clinical protocols. We already have throughout the entire Mayo organization radiology protocols so that tests and procedures are trusted and not repeated and not done excessively. We have in place already a program called Ask Mayo Expert, where physicians throughout the region can consult with physicians within Mayo and find out answers to questions and problems, and sometimes save patients' visits. That's already in place. We have integration of systems and administration to add value, and we're working with other national innovative systems to figure out how to do healthcare better in communities like ours. Our patients should and do have high expectations of who we are as Mayo, and it's up to us to exceed those expectations. We're going to see a lot of change in the future. We're going to be figuring out things together, and we'll continue to keep our patients at the center of our decisions, making our primary value, the needs of the patient, come first, come alive in what we do. So with that said, that's the formal remarks, and really looking forward to the questions that you might have for any of us about what we're doing. So any questions?
When did Emmanuel and St. Joseph's merge, just for historical purposes?
Emmanuel and St. Joseph's merged, I believe, in 1969. It was the first, my understanding, it's the first merger of its type in the United States. And it really is a good point, because community leaders over 40 years ago figured out that coming together as a community is a better way to provide healthcare, particularly as healthcare has become more complex and integration is more important, and finding ways of giving high value. So that goes way back 40 years.
Can you guys talk a little bit about what people might see if they come to the door today, give a new name? Is there anything, other noticeable changes people might see when they come in?
A great question, Rob. The question is, what will people see today that's different? And right away they'll see different signage, different name badges, the way that we answer the telephone, the way we greet people, and some of that's symbolic, but I will tell you that having a Mayo name badge is having a Mayo name name badge is a big deal. It says something about who we are. It's one of the most recognized brands in the world, let alone in healthcare. And it makes people proud to be part of that team. So even though it's symbolic, I do think it will cause changes. And at the other side of that, Rob, is that it just is a point in time, and it means that we're going to continue to accelerate the pace of how we provide care.
So you've already had this working relationship. What specifically will we see in the next year, 2 years that's going to make a difference in Mankato?
We've already had a working relationship, and what are we going to see in the next year or two that's going to be different? Again, we've been part of Mayo Clinic for some time, but this makes it much more clear and more evident. Particularly on the practice side, you're going to see standardization of clinical protocols, the way we do business, the way we take care of patients. For example, we have specialty councils now for almost every specialty, so physicians and providers get together throughout all of Mayo, that includes Jacksonville and Arizona and Mayo Rochester, and get together and decide, well, what is the best way to take care of congestive heart failure or heart disease or certain cancers, and share expertise. There's so much expertise within Mayo. We're working out the system so that those can be shared broadly throughout the organization, with this idea that you don't necessarily have to go to Rochester to get the best care. So you'll see standardization of protocols and information, availability of information for multiple specialties throughout the system.
Does this help in competing, for example, against the Twin Cities like University of Minnesota or Abbott Northwestern? Does that help in that respect?
The question, does this help in competing with other organizations? It's a good question. I don't really think that we think of it that way so much. Already healthcare in southern Minnesota is more affordable. If you look at Medicare data on cost of healthcare, it's less expensive in southern Minnesota than it is in a metropolitan area. And we have lots of collaborative working relationships with many of those organizations, and we'll continue with that. What I think it more symbolizes is the idea that Mayo Clinic has decided that we need to lead the way in transforming the delivery of healthcare on a national basis. We need to find ways to make healthcare more trusted and affordable for patients in the community. So we need to find ways to measure that, and nobody has totally figured that out, and that's something that we think we can do as part of Mayo Clinic.